left, right and centre. Because some of the inner children just want to use heroin. The other inner children just want to kill themselves. They have magical thinking, absolute literal thinking, magical thinking. We covered all that. Egocentric. All of that is happening in 20, 30, 40, 50, 60-year-old people. That's the legacy of complex trauma. So you get someone who's my age, 50-something, but not necessarily. It's like a kid. And so I'm trying to emancipate their inner children from adult roles. Oh, is there another part of you that can go to work? I don't think this part of you that tells the boss to F off is the best part of you. Is there another part of you that can go and meet with, oh yeah, there is another part of me. Phew. I expect progress. Expect it. When I don't see progress, it's not because of the trauma. When I don't, in other words, I expect people to get better. Left, right and centre, I'm looking for it from session to session to session to session. I'm expecting it. If I don't see it, something else is happening. What are those other things that are happening? Well, it could be hormonal stuff. That's what keeps stuff replaying and replaying and replaying. Estrogen's all out of whack, or testosterone, or something's all out of whack. It's not to do with counselling. It's to do with the hormonal system. What's the other big thing that keeps people really dysregulated these days? Everyone's getting a diagnosis for it. What's it called? ADHD. That's the other big player, why people are not progressing. I expect them to, when I don't see it, it's something else. So it's complex trauma and hormonal stuff. Complex trauma and ADHD. Complex trauma and brain injury. Learning difficulty. Autism. So there's other factors. I expect to see change. If I'm not seeing change, maybe we've got to look at some ADHD possible assessment, hormonal possible assessment, brain functioning, brain capacity. These are just fair calls. I expect to see people getting better. This notion of people can't get better from complex trauma is just not true. ADHD, hormonal stuff, autism, brain injury, all these sorts of things. And final slide is, with all of this great information and empathy and parts of self and mindfulness and so on, and being creative, missing experiences, we still are not there to be a punching bag. So if my client starts to swear at me, oh, no, well, slow down, Tiger. We're not, boundaries are necessary, boundaries are good. Boundaries help people recover from addictions all the time. Not enabling, learning about enabling and why enabling doesn't work, and why tough love is better than enabling. You've got to meet the consequence of what you do. I'm not going to rescue you from the consequence of your behaviour. No, I'm not going to get you a get out of jail free card. I'm not going to do that. You've got to face the consequence of your behaviour. So, last client story, I was working with this young, beautiful lady. She's about 22. A couple of years back, she's 23 or 24 now. And we've been working for 12 months, face to face, before COVID. COVID hits and we all go online for a little period of time. We do 2 or 3 appointments online, and in the 4th appointment online, the client turns to me and says, "Philip, you're the problem." Uh-oh. So she starts to shoot me across, it's across the internet, so it's a little bit okay. But, it's a pretty much, "Philip, you're hopeless, this is not working, blah, you're the problem," left, right and centre. It was just and so when my client I said, "Oh, let's stop. Boundary. Let's stop this now. I don't see this as, I don't want to have an argument about, no, let's pause this right now. let's hit the pause button. This is not going in the way that therapy usually goes, where one person or the other gets beat up. No, we try and avoid beating up either party. So let's stop this right now. Let's wind it up for today. Like, I know you're really upset and you're just hating on me really strong, no problem, but this is not therapy, and I'm here to do therapy. So you give me a call down the track if you want to, I'll be here. Okay, I'll see you later. So we wound up, 4 months went by. Okay, we all came back to face-to-face therapy after 4 months anyway. The client came in and her progress was exponential. Okay, holding that boundary. No, I'm not a puncher. No, you can't push it on me. No, it's not okay. I'm not. You know, if I make mistakes, I'll say I'm sorry, but it's not about me. Now, this person really owned their stuff when they came back into treatment. They were journaling, they were keeping a diary, they were owning their stuff. They made amends to their auntie, they made amends to their uncle. And I was moved to tears. The amends was so genuine, was so beautiful. The client really grew exponentially. So boundaries, left, right and centre. I worked in drug and alcohol field for most of my life. Boundaries are absolute necessity. I will pause there. What questions, comments, bits and pieces, discussion, anything that stood out for you that you need a little bit more information on?
I just wanted to ask you, in view of everything you've said here today, do you think that the diagnosis of borderline personality disorder has any value?
So the question is does the diagnosis of borderline personality disorder have any value? It's loaded. It's a loaded term. I think the diagnosis does, but the label itself is used so disparagingly by, in Project AIR and Wollongong University. They're doing heaps of stuff, Professor Greer, to change all of that. Greer, but I just feel like it is a term that it's like a throwaway term. Oh, that person's borderline. You've got to get rid of that person. I had a supervisor, Rod and I were working together many years ago. We had a supervisor come in to do group supervision. And we were presenting our clients, and the supervision was, oh, that person's borderline, you should get rid of them. And we looked at each other, we thought, shit, we're getting rid of all of our clients if we do that. So, people want to, I think it's you've got to be careful with all of this language, all of these labels, all of them. But that one in particular is a very loaded.
Yeah, no.
They're changing, aren't they?
I'm not sure, I hope so.
Yeah, I think they're changing, but I'm not sure they'll
Yeah,
change.
I would hope so. There's a massive problem still about schizophrenia. People still don't understand. Colin Ross makes it very clear that there's endogenous schizophrenia versus dissociative subtype, which most schizophrenic people would fit into. They're not endogenously psychotic. Their actual thoughts and persecutions and psychotic states actually have some sense, make some, and you can talk to the voices and the voices can respond to you. Now that's not endogenous psychosis. And that's most of the people with schizophrenia, and yet they're all given the label of schizophrenia like it's the one thing. It's not. There are people who have word salad who you can't make any sense and are truly endogenously psychotic. But there's a whole bunch of other people who are very dissociative and traumatized and hearing voices and having commands to kill themselves and do all sorts of interesting labours of Hercules. And it's not necessarily completely psychotic. That's the majority. These are ongoing issues, ongoing matters to be clarified. Any other comments, questions?
I'm just interested, like you made the point that complex trauma is normally when you've had trauma over a number of episodes or things, but we see students and things that have got PTSD, and they say they've got complex trauma. It was one event
Yeah, and that's a fair call. You can get in more in adolescence and early adulthood and adulthood. You can end up with repeated exposure to stresses, which becomes like a complex
Yeah, 'cause there's
sequelae.
different ones, not just one.
That's right. Not necessarily. You're a bit more robust,
Yeah.
but it's still going to take its toll on you over time.
Yeah.
And so it's like a complex trauma later life onset. It may not be quite as dissociative as the early life onset stuff, but yeah, it's still going to have very negative impacts.
I guess as you said previously, it would depend what you brought to that trauma beforehand.
Anything else, Rado?
No, I just want to get that sheet, make sure that sheet's signed before.
Sign-in sheet is going around everybody, make sure everyone's signed in.
Attendance form.
Thank you all very much.
Thank you.
Thank you those online.
Very good.
Pleasure. Thank you, Robert.
Everybody, and thank you so much, Philip, for coming and speaking to us. It's wonderful. Yes, we have known each other for 20 years, and I love him, and I don't have any hesitation in saying that. And if you just put your hands in your pockets and leave 100 in the door and go out, he'd love you some more. It's all voluntary. It's from Philip, and it's so appreciated. So thank you very much. There's a lot of work in that, and I hope you've got some really helpful takeaways from it, because it's we've got a huge task in front of us in the mental health world, and it's just so complex and so mixed. And Leslie came up earlier and mentioned the disability aspect that's mixed up with all of this, because those of us that are involved in working with disability, as well as the complexities in trauma, it's a whole different level, and we've got a lot of love to put out there to keep it all going. So thank you very much. I would love to be able to have more of these sorts of gatherings here. If you would like to send email to me online of what you would like to see presented in the Shoalhaven Mental Health Professional Network, I would do whatever I possibly can to make stuff happen. I'm semi-retired, but a big part of me got left over because he taught me. It's amazing. The opening of consciousness that happened for me as a near 40-year-old was fantastic, and it was amazing. It started because when we did Hakomi training together, so it's beautiful.
Thank you.
If you'd like to make a comment, please send me an email or whatever. Having Wednesday meetings is to avoid the weekend leftovers where people take days off from the weekend or Monday to Fridays. Lunchtime is convenient, so you can nick off from work for 2 hours if you can, and still this is more valuable, getting education and taking it back out into your community, than the 2 hours that you would spend at work, I'm sure. Thank you very much. Yes?
I'm just asking, do we get a certificate for our professional development?
If you've registered online, it should happen.
Okay, thank you.
Thank you. Take care, everyone.
Could I ask you a question? Is there any chance of getting a copy of the video or the...
Ask Philip.
He said to ask you.
Ask her. Yes, we can get it. We